So, how do we reconcile the difficulty of naming emotions following trauma and Dr. Vanderkolk's emphasis on the importance of talking with this story? Dr. Perry provides another example of helping a young boy after he witnessed the kidnapping of his sister. The boy did not want to talk, and it seemed that he could not recall any details of the incident or kidnapper. Dr. Perry knew that the first thing that needed to happen was to establish safety, allowing the boy's responses to him to help him know when he was ready. Everything needed to happen at the boy's pace. In the above story, the boy hadn't wanted to talk to his mother, but something in the woman at the cash register made him feel safe enough to say out loud that his mother had died. Her response offered sympathy and caring, but did not push for more. It was enough, and it was progress. In the second boy's situation, Dr. Perry went to his house. He discusses the slow process in 10-minute sessions that eventually helped the boy feel safe and relax enough for his mind to recover memories of the incident. He started by being present with the boy's mother, and she introduced him to her son as her friend. The boy was highly guarded and uninterested. Dr. Perry left the house for 10 minutes to get coffee for himself and the mother, and when he returned, he made another attempt at connection. Eventually, after repeated small attempts over periods of short exposure to his presence, the boy allowed him to sit with him, then eventually brought his favorite toy for him to play with. This was a good indication that safety was established. He asked careful questions and allowed for the boy to determine if he was willing to talk or not, with no pressure. The boy was able to recall details and talk about his experience little by little. Dr. Perry always allowed the boy to set the pace, maintaining a feeling of safety. It can be difficult to have this kind of patience when our minds just want resolution. Just like the Zeigarnik effect we talked about earlier, it is going to be hard to think about much else until you feel that a resolution has been reached. However, the most important part of healing is allowing it to move at the pace of your child's needs. This is why the most important thing you can do is seek out a therapist who is trained and skilled in work with children in trauma. Trauma training with adults is one thing. Working with children in trauma requires an additional skill set. Additionally, seeking help for yourself with someone trained in trauma therapy is imperative. It can help you calm yourself around not being at a point of resolution, but actively working on memories related to the trauma to help your mind manage the anxiety of the situation a little better. Let's pause here to address the questions for this section before we move on to talk about the way these trapped emotions impact the way we feel about ourselves. Question number 1, can you remember a time when you were younger when you had a hard time talking about something that was hard for you? With your adult perspective, what was that experience like for you? And question number 2, do you recognize a struggle in your child to discuss the way that they feel? What does that struggle look like? And how would you like to create safety and understanding for them?